Vaginal discharge can be completely normal, but when it's accompanied by pain, itching, redness, or a strong odor, it may be your body signaling an infection that needs attention. In this video, we'll explain what these symptoms mean, the most common causes, and how they're treated. Normal vaginal discharge helps keep the vagina clean and balanced. However, changes in color, texture, smell, or discomfort may indicate an infection, especially if symptoms persist or worsen. Common warning signs include persistent itching or burning, redness or swelling around the vaginal area, pain during urination, pain during sex, also known as dyspareunia, strong or unusual odor, pelvic pain, or unexpected bleeding. Common infections and their symptoms. So let's talk about yeast infections. They often cause thick white discharge that really looks a bit like cottage cheese. You might also experience some intense itching and irritation, along with redness and swelling. And yeah, there can be a burning sensation during urination or sex. Yeast infections are pretty common and usually not serious, but they can definitely be very uncomfortable. Now, moving on to bacterial vaginosis, or BV. This happens when the natural balance of vaginal bacteria gets disrupted. Some symptoms you might notice include thin, gray, or white discharge, as well as a strong fishy odor, especially after sex. There might also be mild itching or irritation. BV is not a sexually transmitted infection, but it does need treatment to prevent any complications down the road. Trichomoniasis is a sexually transmitted infection that, well, might not be as well known as others. It can cause a greenish or yellow-green discharge, sometimes with a frothy or bubbly texture and a strong odor. You might also notice vaginal itching or burning, or even painful urination or discomfort during sex. The tricky part is, many people don't even realize they have trichomoniasis, which makes testing and treatment especially important. Treatment really depends on the cause of the infection. Yeast infections are, typically treated with antifungal creams, suppositories, or oral medications. Bacterial vaginosis is usually treated with prescription antibiotics. Trichomoniasis, on the other hand, requires specific oral antibiotics for both partners. It's super important not to self-diagnose, since symptoms can overlap quite a bit. Using the wrong treatment might actually make symptoms worse. So when should you see a healthcare provider? Well, you should definitely reach out if your symptoms last longer than a few days, if you experience pain, bleeding, or fever, or if your discharge seems unusual in color, texture, or smell. Also, if symptoms just keep coming back. Getting a proper diagnosis ensures you get safe and effective treatment. Your body communicates through symptoms, so don't ignore the signs. Early treatment can really help prevent complications and restore your comfort and balance. This video is, of course, for educational purposes only and doesn't replace professional medical advice. Always consult a qualified healthcare provider for diagnosis and treatment. And hey, subscribe for more women's health education and wellness tips.